Hello guys, welcome back to the very first episode of Learning with Altura. So today I will be talking about the birth control implant, what it is, side effects, how they insert it, how do they remove it, and a bunch of fun facts about it. So first, what is the birth control implant? So the birth control implant is a tiny thin rod which is about the size of a matchstick. It releases a hormone progestin. So I have a little model here that I will show you guys. It's very tiny. It just looks just like that. So what happens is whenever they insert it, they will numb you first on your upper arm. Once they numb you, they'll have this little inserter tube. They'll go ahead and insert it with the implant, and I'll go ahead and go in. So the way it works is that the hormone progestin is released into your body, and it thickens the mucus of your cervix. So whenever your mucus is thickened, it stops the sperm from swimming into your egg. Alright guys, so the birth control implant is a long-term method. So with that being said, it can be in your upper arm up to 5 years.
Wait, but what if I don't want to have it for 5 years?
Yes, of course. So whenever you want to take it out, whether it's because you want to get pregnant or you just no longer want to be on birth control, you would just talk to your provider, let them know, and the implant can be taken out at any time. It's not permanent. So whenever you'd like, just take it out. All right. So how effective is it? You may ask yourself. The implant is more than 99% effective, meaning that 1 out of 100 women who use it may get pregnant in a year. That is a very great percentage.
Wow, that's great.
Yes, so the implant does protect you from pregnancy, but does not protect you from STDs and HIV. Do you guys know what does?
I know.
Yes.
Abstinence?
Besides abstinence.
Condoms.
Yes, guys. So condoms is actually the only method that protects you from STDs and HIV.
So how long after getting the implant can you have sex?
Okay, so that all depends on when the implant was inserted. So if the implant was inserted within the first 5 days of your period, you can start having sex right away. If it was after, you will have to use a second method of birth control for at least a week. The reason is the implant still isn't working effectively, so you want to wait a week and use a second method, like condoms, and then after a week, you guys will be fine without any condoms.
All right, cool.
Yes. All right, guys. So now I'm going to go ahead and talk about some side effects. The most common side effects are light bleeding, brown discharge, long-term spotting, and then your periods may get heavier and longer, or sometimes you may not have no period at all, which, by the way, is totally safe. You do not need to have a period. These side effects last from the first 6 to 12 months. After that, your body will get used to it, and you shouldn't experience the side effects. Some other possible side effects that aren't common, it would be headaches, breast pain, nausea, and weight gain as well.
When you mention gaining weight, you know how a lot of people said, the minute that I started getting on birth control, I started getting like fatter.
Yes.
Is that true?
It does have some truth to it, but whenever they say weight gain, it's 5 to 10 pounds max, guys. Okay. Other than that, you're not gonna be gaining 20, 30 pounds, you know? So yes. All right, guys. So whenever the implant is being removed, it takes a couple minutes. So what they do is they'll go ahead and numb you again, and it's after your 5 years or whenever you prefer to take it out. So they'll go ahead and do a little incision, and they'll go ahead and take it out. It takes a couple minutes, like I said, and then after they numb you, you shouldn't feel a thing. But then again, you will experience soreness, tenderness, and bruising as well. But it's gonna go away.
Okay.
Yes.
That's sort of cool fun.
Yes, guys. So I hope you guys enjoyed this. If you guys have any questions, any topics, feel free to let us know.
Go ahead and make comments. If you guys want to have a private conversation with Izzy, or you have any questions for Izzy, go ahead and send her a direct message, and she'll be able to get into all your questions or concerns.
So next week, I'm going to be talking about vaping and teens and the dangers of vaping.
All right. Well, hope you guys liked it. And leave any comments on we said.
Thank you so much, guys.
Thank you.
Bye. See you next week.